Forensic pathologists are specially trained physicians who examine the bodies of people who died suddenly, unexpectedly, or violently. They determine the cause, which is the ultimate and immediate reasons for the death, and manner of death, which can be homicide, suicide, accidental, natural, or unknown. To determine the identity of the victim and the time, manner, and cause of death, forensic pathologists study medical history of the victim, evaluate crime scene evidence, including the witness statements, perform autopsies to uncover evidence of injury and disease, and collect medical and trade evidence from the body for further analysis. Clinical forensic pathologists examine living patients, usually in cases of sexual abuse or assault. Pathologists ensure that procedures regarding evidence collection are followed, and they coordinate their work with law enforcement. Once evidence is analyzed and gathered, the pathologist creates a written report and may testify in court. A forensic pathologist must first earn a bachelor's degree and then a medical degree, either an MD or DO. They must have extensive additional education and training, including 4 to 5 years of training in anatomical, clinical, and/or forensic pathology, and a 1-year residency or fellowship in forensic pathology. After that, they must pass an exam to become board certified. They must be strong in all areas of science, have great communication skills, and have great writing skills. Forensic pathology uses chemistry, physics, biology, psychology, and anthropology. Practically half of the job is writing reports and giving testimony. The preparation timeline for becoming a forensic pathologist starts in high school. You should take advanced math, science, and English courses, develop strong writing skills, and practice public speaking skills in class and by joining the debate team. In college, you may choose any undergraduate degree, but make sure to take all of the required math and science classes for admission into medical school. You should seek out experiences that expose you to different cultures and perspectives, as well as consider learning a foreign language. In medical school, you want to focus on patient care, do an autopsy pathology rotation as an elective to make sure it is what you want to do, and explore opportunities to work or do a rotation at the local medical examiner's office. Some forensic pathologists work for the city, county, or federal government, and others work in hospitals, medical schools, or private groups or practices. Pathologists spend most of their time in the lab performing autopsies or examining tissue samples under microscopes. This job involves standing for long periods of time and working with small tools. The typical workday for a forensic pathologist is 10 to 12 hours, especially if you are called to examine a faraway crime scene. Over time, this job may emotionally affect you due to the constant exposure to graphic violence. Becoming a forensic pathology is not easy. It requires a lot academically, things like high-level classes and a minimum of 13 years of education and training after high school. The job requires a strong stomach because it is usually pretty gruesome, and dead bodies definitely do have a smell. You also need lots of confidence to defend your conclusion against lawyers, the media, or even the victims' families. The good news is the salary is $105K to $500K a year, and the job outlook is great. There is high demand for forensic pathologists.